Hello and welcome to the Washburn County 2019 Health Insurance Overview presentation. In this presentation, I will explain eligibility periods and give you an overview of our medical, dental, and vision plans. So the first eligibility period I'd like to talk about is open enrollment. Open enrollment is a period of time when employees may make a change to their elected benefit plans. Once you make these benefit plan elections, they will be in effect for all of 2019. Open enrollment only occurs once a year during the month of December, so if you plan to make any changes, please submit your enrollment change forms to me as soon as possible. You may make benefit election changes during the course of the year, but only if you have what's called a qualifying event. A qualifying event allows you to enroll or make changes to your plan outside of annual open enrollment. Examples of qualifying events include a change in marital status such as marriage, divorce, or death of a spouse, a change in the number of dependents due to birth, adoption, court order, or a change in dependent eligibility, a loss of other health insurance coverage, or employment status changes such as commencement or termination of employment. So let's move on to the 2019 Group Medical Plan Overview. Washburn County will continue its medical insurance through the Wisconsin Counties Association Group Health Trust, UMR. We are making some minor plan modifications this year. We've added an in-network benefit for in-office mental health visits that utilize teleconferencing technology. We've added prior authorization requirements, and the oral surgery benefit has changed. Here is a comprehensive look at the new prior authorization requirements. In the first column, you will see that the WCA has added a number of services and equipment for which you will need to obtain a prior authorization. The second column shows any non-compliance penalties, and the last column gives you additional information about the requirement, including who is required to notify UMR for authorization. This is the complete list of our new oral surgery benefits. Compared to last year's plan, there has been a reduction to the number of covered procedures, so please see the full plan documents in the S drive for a comparison. This slide shows you our 2019 medical premiums. Premiums have not changed for non-represented employees this year. The per pay period deduction for medical insurance will remain at $48.38 for single coverage and $123.52 for family coverage. Premiums for the represented law enforcement group are shown in the second table. The per pay period deduction for medical insurance will be $52.25 for single coverage and $133.40 for family coverage. So this is an overview of some of the covered expenses included in our medical plan. I will be describing the in-network benefits here. Our in-network deductible will remain at $1,000 for an individual and $2,000 for a family. We have 100% co-insurance, which means that once you reach your deductible, the insurance company will pay the remainder of that bill. Our medical out-of-pocket maximum, which includes deductibles and co-insurance, is capped at the $1,000 for an individual and $2,000 for a family. The combined out-of-pocket maximum, which includes deductibles, co-insurance, and medical co-pays, is capped at the $2,600 for an individual and $5,200 for a family. So this is the medical plan design overview. I will describe our covered services and what it would cost to see an in-network provider. Office visit charge. We are charged a $20 copay for office visits. The balance of the office visit charge is paid at 100% and the deductible is waived. However, other expenses performed in the office on the same date could be subject to the deductible, so please see the full plan document or call me if you have any questions. There is a $50 copay per urgent care visit. The urgent care benefit is subject to the deductible, so if you've met your deductible, then the remainder of the bill would be paid at 100%. The emergency room benefit. There is a $150 copay per visit. which is waived if you are admitted to the hospital directly from the emergency room. Emergency room visits are subject to the deductible, and after you've met your deductible, the remainder of the bill is paid at 100%. Hospitalization. Charges are subject to the deductible, so once you've met your deductible, charges are paid at 100%. There is a $100 copay for high-tech imaging, which includes MRIs, CT scans, and PET scans, and the remainder of the bill is paid at 100% after your deductible has been met. X-rays and lab tests. All charges are subject to the deductible, and they're then paid at 100%. Note that all covered X-rays and lab tests, whether routine or with a diagnosis, performed in conjunction with a wellness exam, are payable the same as the wellness benefit. And for more information on the wellness benefit, you can see the full plan document on the shared drive. This is our prescription drug plan overview. On this slide, you see the copay for retail and mail order prescriptions. The retail copay refers to a prescription filled at a physical pharmacy location like Walmart, Walgreens, or Shopko. Formulary drugs are those medications that are preferred by our health plan. As you can see, non-formulary prescription drugs do have a higher copay. You can find our drug formulary and specialty list on www.caremark.com. So if you want to save a little money, you can order your 90-day prescriptions directly from CVS and have them delivered directly to your home. You can find their number on the back of your ID card. Note that specialty mail order prescriptions are limited to a 30-day supply. The pharmacy out-of-pocket maximum is $4,000 for an individual and $8,000 for a family. Washburn County has established an HRA for all employees enrolled in the group health insurance plan. So what is an HRA? Health reimbursement arrangements, or HRAs, are designed to reimburse employees for qualified medical expenses up to a maximum dollar amount for a coverage period. HRAs reimburse only those qualified eligible medical expenses agreed to by the employer, which are not covered by the company's insurance plan. Washburn County HRA funds reimburse deductibles only, up to a maximum dollar amount for a coverage period. This slide gives you an overview of how the HRA works. The first column gives you the 3 HRA reimbursement levels: single, employee plus 1, and family. The second column explains that the only expense for which Washburn County allows HRA reimbursement is the deductible. The third column describes the amount of deductible an eligible family member must reach before they are eligible for an HRA reimbursement. And then in the last column, it describes the total amount of HRA reimbursement for which an individual and family are eligible. So this is a quick HRA Q&A. Question: do I need to submit a request for reimbursement from my HRA? The answer is no, you do not. Reimbursement for qualified eligible expenses, in our case, the only expense eligible for HRA reimbursement is a portion of the deductible, will be made to you automatically via direct deposit based on reports from UMR Advantage Flex, or HRA third-party administrator. Question: who contributes to the HRA? The answer is contributions to the HRA are made solely by the county. The full annual contribution is available from the first day of the plan year. Question: what happens to unused funds at the end of the plan year? The answer is HRA funds not used within the plan year do not roll over, and the unused funds are forfeited. Washburn County will continue to offer dental coverage through the Wisconsin Counties Association Group Health Trust, UMR. The plan benefits will remain the same. The only change will be an increase in premiums. This slide shows you what our 2019 dental premiums will be. For non-represented employees, the new per pay period deduction will be $1.91 for single coverage and $4.78 for family coverage. Dental premiums for the represented law enforcement group are shown in the second table. The per pay period deduction will be $2.07 for a single coverage and $5.16 for family coverage. This is the dental plan overview, and I will quickly go over the benefits. For an individual, the deductible is $50, and for a family, it is $150. The calendar year individual maximum benefit is $1,000. Preventive services, which include oral exams, routine cleanings, fluoride treatments, and sealants, are paid at 100%, and the deductible is waived. Basic services, which include emergency services, bite wing and full mouth x-rays, fillings, minor periodontics, and simple extractions, are paid at 80% after you reach your deductible. Major services, which include root canals, oral surgery, and crowns, are paid at 50% after you reach your deductible. Prosthodontics, which include bridges and dentures, are paid at 50% after you reach your deductible. Orthodontic services, which include orthodontic diagnosis, treatment, and appliances, are paid at 50% after you reach your deductible. There is a lifetime maximum of $1,500 paid per covered dependent child under the age of 19 only. Washburn County will continue to offer vision coverage through Delta Vision. There will be no changes in cost or plan benefits. Here you can see the employee premium cost for vision coverage. The premium costs have remained the same, so the per pay period deduction for single coverage is $2.39 and $5.94 for family coverage. This is the vision plan overview, and I will explain the in-network benefits. There is a $0 copay for vision exams. Standard single vision, bifocal, and trifocal plastic lenses are covered in full. There is a $150 allowance, then a 20% off the balance on frames, payable once every 24 months. Standard contact lenses in lieu of spectacles. We receive a $150 allowance, then 15% off the balance. We receive a $150 allowance for disposable lenses. Contact lens fit and follow-up. The member pays nothing for standard contact lens fitting and follow-up, but for premium contact lens fitting and follow-up, which includes toric, multifocal, extended wear, rigid, and gas permeable lenses, we receive a $55 allowance plus a 10% discount off the retail. So if you have any questions about this presentation or about the health plan benefits in general, please don't hesitate to contact me. Thanks for watching.